Hey everybody, talking a little bit more about contraindications today. We're going to state the contraindications of PBMT in health and medicine more broadly, because it's really important to make sure that we're avoiding patients that may be at risk or may not get as good at outcomes, and it's all about practicing safely so that we can get those good outcomes more often. Here we're going to go straight into it. So it's not for the use on open eyes at those higher class levels. So as soon as we're looking definitely within those class 3B, that class 4, we're wanting those glasses on. It does depend on the laser level, but if you're unsure at all, you need to be steering clear of putting any lasers near eyes, even to the point where wearing an eye mask can be a really good thing. And this is something that we need to police with our patients. If we've got kids or patients with dementia, Alzheimer's, some of our neurological conditions, we just need to be aware of that so that we're putting people in the safest position as possible. For those that are pregnant or may be pregnant, asking those questions, because we don't want to be treating that stomach or the lower back area where we may be in that abdomen area. And it's not that the research says that it's bad, it's just that we don't have research there. Of course, this isn't going to pass ethics, and so we need to be really aware of what impact it's going to have. We don't want to be doing that in when we're not sure. So just avoid it. I personally feel pretty comfortable treating the feet. When I've got a patient that's pregnant, and I've done that several times to a really good outcome. When we're talking about steroid injections, of course, there's another intervention that we maybe use concomitantly. I would suggest that we're not wanting that steroid sort of, within a day of having had PBMT, and I would probably leave it about 3 weeks before we undertake any further laser therapy or PBMT after the injection. And for me, that just allows that steroid injection to take effect, know if we're going to have a good outcome, and then if we're still needing to have a good top up from some PBMT longer term, then we've definitely got that ability to do so. Then we start talking about our oncology area, our malignant lesions, whether that's superficial or deep. And the research is, saying that it is safe, and the, safety side of that's really important. But you as a practitioner needs to be aware of the risks associated with this, more from the psychological point of your patient, and saying some people with patients with cancer are going to have this reoccur, and it may not be due to the laser, but it may occur in that area. But there's great research saying that it is safe, that it is going to reduce our pain and reduce potential lesions coming up that are wounds like our oral mucositis during chemotherapy, for instance. If you're unsure, then you need to talk to one of their specialists, their GP, their oncologist, and just say, this is what I want to put into place because of X, Y, Z, and be comfortable with that as a practitioner. Communicating this with your patient is really important. Consider epilepsy or photosensitive conditions and their medication as well. If that is the case and they're comfortable, say, with epilepsy to put an eye mask on, that could be an easy fix. But for those that maybe have lupus and have photosensitive medication, you need to be aware of that so that you can potentially have either a lower intensity or potentially you can't undertake that because it is going to cause heat, potential burning and damage that is not what we're wanting, okay? Again, it's all about that safety with our patients. If you're unsure, again, talking to their specialists around that. With our pediatrics, and particularly when we've got open growth plates and we may be treating, an apophysitis such as severs, consider a shorter course or avoiding it. But typically what I'll do is I'll treat bilaterally to ensure that if we are going to be treating a growth plate, that growth plate may speed up. And I'd hate to see a kid have a leg length difference because I've successfully treated their severs, but haven't been able to, treat bilaterally for whatever reason. But that's sort of one of the ways to look at that as well. But, putting this into practice is important. Being safe is everyone's responsibility. Talk to your colleagues, reach out to us here, to myself. Let us know if there are any concerns that way or you're not sure. It happens all the time that I have practitioners call me and say, Kent, this is what's happening. How do you think I should go about it? I've got this patient in the room at the moment, and I'm more than happy to answer that call. If I'm available, more than happy to give you the long answers as well. But knowing what to stay away from is really important because that will get you better outcomes. But today, we have talked about those few contraindications. think about how PBMT works, because that's going to give you the best indication as to whether this is something that's safe to undertake or whether it may interact poorly in any way. But for today, that's been contraindications for PBMT, and we'll see you at the next session. Cheers.